Streamlining the patient journey, a community diagnostic centre experience. Our patient's journey begins with a call to their general practitioner. The patient has ongoing back pain that has worsened over recent days. A video consultation is quickly scheduled to try and determine possible causes of our patient's condition. Concern about the symptoms suggest the best approach is a referral for an MRI scan of the lumbar spine, and the referral is delivered to the local hospital. A hospital radiologist reviews and approves the examination request, and our patient is placed into the scheduling queue. With diagnostic testing wait times far higher than average, and to ensure our patient receives a quick and full diagnosis, an immediate referral is made to their local community diagnostic centre. Community Diagnostic Centres, or CDCs, are freestanding multi-diagnostic facilities that are often located away from main acute hospital sites, closer to patients, and often on the high street or in retail locations. Upon referral, a text message is sent from the Philips Patient Engagement app to our patient on behalf of the CDC. In it is a direct link to the online scheduling system. Exam type and personal details are already populated. All our patient needs to do is choose their preferred day and time. So begins our patient's journey through the CDC pathway, a process greatly streamlined by advances in communication and connectivity. Once the appointment is confirmed, our patient receives a text which contains instructions for the upcoming visit. Details outline how to prep for the scan, what to expect during the scan, and a questionnaire to complete prior to the examination. The patient arrives at the CDC, situated on the outskirts of town. A community diagnostic centre is designed to increase diagnostic capacity and patient access. It provides same-day elective diagnostic tests to support early disease diagnosis and enable access to the latest medical technologies, efficient workflows, and robust informatics tools. The MRI suite, where the patient is headed, integrates medical technologies, including the latest Philips MRI system and software solutions, to drive better patient care and staff satisfaction, higher productivity, and improved outcomes. At the self-service kiosk, our patient confirms their arrival and checks into the CDC waiting room. The CDC's streamlined workflow process allows our patient to be greeted promptly by the radiographer and invited directly into the MRI suite. In addition to the scanner itself, our patient is introduced to the Philips Ambient Experience, enabling our patient to choose their clinical environment. Ambient Experience consists of dynamic ambient room lighting, a wall-mounted display for video themes, and the Philips Inboard Connect solution. This includes a mirror which is placed directly in the patient's line of sight, along with headphones for accompanying audio. At the control panel, our patient selects their preferred lighting colour and video theme and is escorted into the room. Resting comfortably on the MRI bed, listening to soothing sounds and watching their selected video, our patient's exam begins. The radiographer provides the patient with visual cues for breathing techniques to ensure their scan is relaxing and stress-free. As the scan progresses, the radiographer in the control room reviews the spinal images. Upon review, the radiographer identifies a suspicious area and contacts the Radiology Operations Command Centre for further advice. A senior Radiology Operations Command Centre radiographer takes remote control of the MRI system and acquires more focused and detailed images, ensuring the most complete examination. Following the examination, our patient departs the CDC and heads home. Meanwhile, Philips AI-enabled workflow orchestrator prioritizes the images for reporting. The report is sent to our patient's general practitioner, who, upon review, arranges for a further teleconsultation with the patient. The patient is also able to access their scans via Philips MyView. The GP and patient go over the report and images together. the GP advises the patient that they are to be referred to an orthopaedic specialist. Throughout the CDC pathway, Philips works in partnership with primary, acute, and independent care providers. Philips designs state-of-the-art facilities, enables access to the latest health technologies and AI, and takes control of equipment planning, financial services, procurement, implementation, maintenance, and performance services. This supports earlier patient diagnosis and provides greater and more convenient access to patients, all while reducing health inequalities and ultimately driving improved outcomes.